The thyroid gland consists of two lobes, the left and right lobes, which are connected by the isthmus. The isthmus lies anterior to the trachea. Note the relationship of the common carotid artery with the lateral aspect of the thyroid. The patient should be lying supine on the examination table. A high-frequency linear array probe with a range of 6 to 13 MHz is suitable for this exam. To obtain a transverse view of the thyroid, make sure that the probe marker is facing toward the patient's right. Place the probe on the anterior surface of the neck between the larynx and the suprasternal notch. Adjust the position of the probe so that the thyroid is in the center of the screen. Note the homogeneous echo texture of the normal thyroid gland. This image demonstrates that the thyroid gland is bordered anteriorly by the strap muscles and laterally by the carotid artery and sternocleidomastoid muscle. Posteriorly, the thyroid is bordered by the longus colli muscles. The thyroid gland is more echogenic than the adjacent muscles and blood vessels.
We start the cervical examination with the trachea with air shadowing phenomena in the center. Shift the transducer to the right side. Identify the common carotid artery and the internal jugular vein. Centralize the thyroid gland. Increase the magnification factor. And start our scan at the upper pole of the hyperechoic thyroid gland tissue and follow the gland to rule out focal lesions or enlargements. Then we rotate the transducer clockwise by 90 degrees. Start laterally. Here we see the common carotid artery and already see the first part of the thyroid gland. And whenever the extension of the gland exceeds the size of the transducer, we decide to scan the upper part first, move or shift the transducer inferiorly, and to scan the inferior part in a second step to assure that every single area of the thyroid gland has been visualized in two sections. For the measurement of the volume of both thyroid lobes, we are looking for the longest craniocaudal distance of the lobe. Check the upper pole and the position or ending of the lower pole. Centralize the lobe again, freeze the image, and measure the approximation of the craniocaudally distance. Here 4.1 centimeters. Then we change into the transverse view and scan the lobe until we see the largest diameters in transverse section. Freeze the image again and measure the largest diameter from right to left, as well as from anterior to posterior, so that we can calculate the volume of each lobe separately.